Case managers, I'm certain that you have had, do have, or will have Latin American nationals in your hospital. Now the question is, do you need help with Latin American nationals wanting to return home to their families? Let me introduce you to MexCare. For nearly 20 years, MexCare has been reuniting families and supporting you, case managers, with unfunded Latin American nationals. We know that every day Latin American nationals are admitted to United States hospitals. These patients are often anxious to return home to their families. In fact, we know that many of these patients haven't been home for years. We also know that hospitals are required to care for these patients indefinitely and often without compensation. We also know that patients here occupy beds that are needed during this critical healthcare crisis. Let me introduce you to George Ochoa and Bob Barraza, the founders of MexCare. You'll get to know them as you interact with us and work on your patients. Let's review what MexCare does. We basically offer you an alternative future for both yourselves and your patients. We work closely with your case managers to assess your patients' qualifications to benefit by our service. We ask the question, does the patient wish to return home and be cared for close to family and friends? Is there a qualified facility in the patient's country of origin ready to provide care? Let me explain the process. We work collaboratively with your healthcare team, the patient and the patient's family to develop a care plan. We obtain clinical data from your institution to develop an assessment of the patient's current and future healthcare needs. If the patient's identity is not certain, we can help with that. We can also help with travel documents. Based on this plan, a proposed budget is presented to the institution. Upon agreement by all parties, including the patient's family, and yourselves, the institution, MexCare arranges for transport to an accepting healthcare team and institution in the patient's country of origin. Discharge and transfer. Once a patient is discharged from your facility, MexCare team will arrive and transport the patient either via air ambulance or commercial airlines. Our MexCare team will accompany the patient to the accepting facility and hand off the patient to the new healthcare team and facility. We will then notify you of the completed transfer and readmission. Here's a photo of one of our patients being transported via air ambulance. Mutual benefits. It's a reminder that our patients and families are reunited and report their happiness with the services we provide. You have a significant decrease in your cost, and you also free valuable bed space. Let me review several case studies that show specifically how we've impacted individuals. This first case involves a 53-year-old gentleman who suffered a stroke with very little chance to recover his ability to communicate or ambulate. We know that the hospital has a long-term obligation to care for this patient. MexCare and case managers develop a care plan that includes care for the patient in a hospital in Honduras, close to his family. MexCare transports the patient and transfers care to the new caregivers. The second case study involves a 42-year-old gentleman admitted with cancer that requires long-term treatment. The patient is unable to safely be discharged and treated on an outpatient basis. MexCare was able to collaborate with the patient's family to arrange for care in a facility near their home in Mexico. Our last case study involves a 35-year-old female who suffered a significant injury due to her motor vehicle accident and then requiring long-term care that the hospital is obligated to. The patient's family was very anxious to be helpful and support their daughter in their home community in South America. MexCare coordinated the transfer and care in the hospital in their hometown. So for you to initiate services with us, you can contact Bob Barraza, Georgia Cho, or myself, really 24/7. We're here to help you. We can quickly make this happen and support your efforts to reunite patients in their home communities. Thank you, and let us know how we can help you.